Hello, everyone, and welcome to another session of Voices of Healthcare Cloud. So with that, thank you all for coming today. We are excited to host another session and have some exciting speakers for you guys. Before we get started, we always like to encourage you to ask questions and participate in the content. So either use the Q&A or the chat in the meeting to post your comments or questions there, and we'll make sure to either answer them or ask the speakers to answer them. So just use that chat panel. Also, you can see we're publishing announcements there. We'd love for everybody to give us a shout out where you're joining from, maybe what company you represent, so we can get to know you. So with that, we're going to go on to the presentation. We are excited to bring some super awesome speakers today. We have Timothy from El Rio Community Health Center and Pat and Suresh joining us as the Chief Strategy Officer and Chief Technology Officer at Quisitive. And we are going to have them talk to us about how improving your supply chain can drive to higher ROI and improve patient satisfaction. And so with that, we are excited to welcome you guys. Timothy, Suresh, Pat, happy to have you today.
Thanks, Shelley. Glad to be here.
Thank you, Shelley. Happy to be here.
Yeah, awesome. Tim, you want to go ahead and introduce yourself?
Sure can. Thanks for the opportunity. This is a great series to be a part of. Great to see organizations like Microsoft putting forward these great content series for different individuals across various global audiences. So thank you. My name is Tim Snowball, Director of Procurement Supply Chain here at El Rio Community Health Center in Tucson, Arizona. And I'll talk a little bit more about the history of who we are as an organization, a little bit of history about supply chain here at El Rio. My background is really in healthcare supply chain. Spent about 13 to 15 years on and off a little bit there in mostly hospital supply chain, and grateful to now be helping out in the community health space. So a little intro there for you.
Awesome. Thanks so much, Tim. And it looks like we have Pat on as well and Suresh. You guys want to go ahead and do intros and then we'll kick it off.
Okay, good afternoon, everyone. This is Pat Becker. I'm the Chief Strategy Officer for Healthcare at Quisitive. I have about 30 years experience in healthcare IT. A lot of it I spent actually as a consultant with the University Health System Consortium, where we did a lot of work in supply chain. So I feel very comfortable with that topic, as well as I've been a CIO at a large academic medical center. So Suresh, I'll turn it over to you.
Hi, good morning, good afternoon, everyone. I'm Suresh Krishnan. I'm the Chief Technology Officer for Quisitive. And I also came from healthcare. I spent 25 plus years in large health systems in the Chicago market as their CIO and CTO. I have significant time within that time frame. I spent implementing supply chain solutions, everything from McKesson to Lawson to other vendors over a period of time, starting with the barcoding supplies to part card management. So I'm looking forward to listening to Tim and following up on this conversation. Thank you.
Okay.
All right, we're seeing your.
All right, very good. Thank you. So as mentioned, grateful to be a part of this here with, as a part of El Rio here with Microsoft and Quisitive. I've been working with Quisitive for about a year now on the solutions that were implemented with Microsoft. That's kind of how we came to be and to know each other, and grateful to have been asked to participate in this today. A little bit of background about El Rio Health. So community health centers, if you aren't familiar with them, started with President Lyndon Johnson declaring war on poverty and this need to ensure that healthcare is available for everyone, and it wasn't always the case. And so a lot of grant funding and program structure came about for community health centers to begin. El Rio Health here in Tucson started and took on that charge in 1970. So we've been around for a little over 50 years now. I've been with the organization just over a year. The service lines that we offer at El Rio, primary care, dental care, radiology lab, pharmacies, and behavioral health. And we service a wide array of customers or clients, patients' needs here in the community. We have financials out there, so we're not afraid to share. We do operate pretty well at a 7 to 9% margin, which is much different than a healthcare IDN typically, especially a not-for-profit IDNs. We aren't as large as, say, an IDN or health hospital system, but operating at around $250 million a year in revenues. So I'd just like to give a little background about who we are as an organization, and I'll talk a little bit about who we are in our supply chain so you can see how we've changed and moved forward a little bit. So for 45 years, a lot of the structure of the supply chain, I mean, people didn't call it supply chain 10 or 15 years ago, much less, 50 years ago. It was just a buying function that existed under the facilities management department. And as a smaller, say, 1 or 2 clinic location at the time, there wasn't a lot of need to expand and grow that and put a lot of strategy behind it. But as growth has changed and our integration between how supply chain and procurement work within finance and allow revenues to be supported through having more cash available, it's important to monitor and track those expenses. And we've really developed into a much larger industry, that being supply chain. It was only 6 years ago that El Rio determined that we needed to advance and grow this a little bit more and have a more designated focus of a procurement team and a couple more FTEs and put a little bit more foundation around it. And only in the last year since I've been on board, the organization decided to invest into a little bit more growth. And so I've had that opportunity over the last year to do that. So what has needed that drive and that push is growth. Is probably the main thing that's driven that, as our organization has grown from just 2 or 3 early clinics to now we have 14. 14 isn't huge, but for a health center, community health center, it is a decent size. And at the time, just being a little centralized buying group, we now have been able to say we need to expand that and allow our health center leadership to focus on patient care and quality initiatives, because they were the ones that are having to purchase a lot of their supplies prior to that. And so we needed to really put our focus where focus was needed, and that's to our patients. So as that leadership team grew, we needed to provide them more accountability to be leaders in healthcare, in patient care. Another couple of reasons were the pandemic. Obviously, we've all felt the pains of that, especially in the supply chain, as we all know. Both in 2020 for sure, and then we again just felt it a little bit with Omicron in the last 4 to 8 weeks, and it's really brought to light the need to focus and make supply chain a strategy within the organization. With that too, there's just this lack of transparency and not knowing what. Kind of thinking about where our next meal is going to be, just as an idea, right? Not really a meals, but we didn't have the ability to know and have faith that we were going to always have the shipment coming in that we needed for our staff. So bringing more transparency and identifying shortfall areas where we needed to ensure that we could always take care of our patients and not turn people away. In early 2020, El Rio did have to make the difficult decision to discontinue our dental services for several months to be able to support staffing and supply that we did have to the medical care, as a lot of dental was focused on preventative, and to help out with those who are actually getting sick with COVID-19. So how do we avoid that, right? It's more than just supply chain, but supply chain was a big piece of it. How do we avoid that going into the future? And we have seen great signs with Omicron when it spiked that we have made improvements. There's still ways to go, but we've made improvements over the last learnings from the last couple of years. So what did we do in 2021? We did a complete reorganization of our warehouse and identified what items are in there, what items should be in there, what has the most impact on us being able to continue business. When something was not available to receive, how did we respond? Did we have what I've always actually called a pandemic supply, emergency supply? And we learned that we were not sufficiently prepared, and so we did a complete remodel of that. And if you're familiar with 5S or lean methodologies, right, going in, we had to sort everything out and identify and get rid of things that we didn't actually really need. They were just in the way. And then set everything in order and prepare for a standardized process after we cleaned it up, shined it up, and then create sustainable methods to keep driving the use of that warehouse appropriately to keep us on track. And then putting more effective and efficient processes in place to help guide us along with how we utilize that. Again, part of the sustainment and standardization. And what we've been able to do is probably about quadruple the impact of what we're providing out of this central supply warehouse, and turn product around much more quickly, and having focus to bring product here that only needs to be here, and product that we're ordering direct from a distributor, let it go direct to the sites. However, we had to build the structure to receive it at the sites appropriately so that we could have quick turnaround and not have it fall out from that. Part of that was the centralized inventory control. What we did was model what I've used in hospitals, whereas you would have a supply chain team that goes out to nursing units in hospitals where we are clinic focused, right? And have staff that float and oversee 3, 4, 5 clinics and put those people, invest them into the healthcare team at those clinics, let them be almost a part of their team, still reporting up to supply chain, but reporting out to those teams as well and partnering with them to ensure that they have what they need and they don't have to spend the time thinking about it. If you've ever been on a nursing unit or in a health center, you know that the medical staff just want to go and grab a supply and get out of the way, right? That is our job, is to make sure they can always do that. And it impacts patient care dramatically when we have to, when they would have to say stop what they're doing and now start asking questions of different individuals on where's this product, how do I brainstorm if I don't have the product to still take care of the patient. And so this was a huge step forward in making that happen, and have standardized processes to help us, again, sustain what we're doing in those health centers. So all of these two things, the supply warehouse and the implementation of centralized inventory control, needed to be supported by a system. And that's where Quisitive and Microsoft come into play. We had a great need to have more transparency of our own data and have a system that allowed it to feed for reporting and efficient flow of purchase, the P2P process, procure to pay process. And so we implemented a new platform of finance and operations of Microsoft's Dynamics D365 platform. And all of these items here, item master, requisitioning, our purchasing, inventory, receiving, payment, fixed assets, and general ledger, we're all part of that to have an all-encompassing platform that allows us to process day-to-day efficiently and effectively. And that's from the end user perspective to the back office perspective to the reporting. And it's all linked together. That's now allowed us to be more efficient and effective, centralized, so that we can be effective for the patients and the clinical staff. So some of the outcomes that we've received because of doing this, you see here on the screen. So warehouse items now have continual movement. Before, we had a lot of stagnant items that would sit and didn't have a lot of usage or intent. So now we're seeing a continual turn. Our automated reorder levels for our warehouse are now in place. These are a lot of these things. If you've been in an established hospital IDN, you'd say it's pretty standard and normal, and it's pretty archaic if we didn't have these. But at El Rio, we didn't, and part of having a strong ERP has allowed us to have some of this. So PO confirmations to take timely action on back orders and processing our back order reports has become more possible and quick in how we take action on it. Having sufficient stock for at least 30 days on hand, that's a lot due to how we manage and organize this warehouse with 5S lean methodologies, and having the system to support the binning and the picking and putting away process for all those items. I want to be careful and call out this stat here: 5,250 hours annually freed up for clinical leaders and staff. That is a very good number that we feel confident on. However, a lot of it came from due to the fact that we now have FTEs in place, right, into their health centers. So it's not all system supported benefit, but because of the system, we're able to allow our people to be in there and process things quickly, effectively, and without the leadership's input. And it's when necessary. I don't want to say we don't include them, because we do, but from day-to-day management, it's not necessary. But we are so grateful to be able to see that we're able to give our clinical leaders this time back to focus on quality initiatives and patient care firsthand. We're working to have more visibility and controls on our POs, and we're working towards a 95+% of all of our purchases being on PO. That's a very high standard for us to try to meet, but we're making great progress to get there. And with that, the system gives us the controls for three-way matching and approval hierarchy that we get to set and work with Quisitive to know what are the right steps to make that happen within the system. And the Microsoft databases, it allows and supports that. As well as achieving, I just talked about approval hierarchies and the three-way match. Manage inventory at point of use with a min and max. So there is the ability for us within the database to set up part locations for all of our different sites and all the different supply rooms, very much like other major ERPs that are out there. This system allows us to do that and manage and work from day to day in that method. We also have been able to work towards not having stockouts and very much limiting our overstock, which was also an issue. A lot of people would order quite a bit and not be able to find what they need, so they order more because there's too much in there. So again, the organization and 5S steps came into play. Ability and time to plan for disruptions is now in place because of a lot of the organization that comes with the system and the new processes. And we've saved a lot of time, steps, paper processes. We used to have a more, I would call, archaic process for how we manage requisitions. And we've went from about 11 pieces of paper for each PO down to 1 or 2, depending on the PO. But we're very grateful and proud of the work that we've been able to do the last year. All of this so that we can, again, put more value back to the patient care and those clinical leaders. One other caveat here is that the better we manage this, the better we manage our finances. And as a not-for-profit, we're able to then, with those savings, put money back into new programs and develop more care for our patients in our community. So with that, open to questions, whether that's now or down the line, but I'll end here and just again, grateful for the impact and outcomes that supply chain can have in a healthcare organization and how pivotal and important it is for us to manage it well.
Hey, Timothy, awesome. We did get one question from the audience specifically around the ability to come to that 5,200 hours that were freed up. Not that they're questioning that, but how you calculated it. Like, how were you confidently able to say this is the amount of time saved?
Yeah, absolutely. That's why I definitely wanted to caveat that one with some caution, right? Because if it's taken out of context, what we did was spend a lot of time piloting our process and how we wanted to go through bringing new inventory coordinator FTEs into the clinic space. So we brought on a new inventory coordinator. They started learning what was already in place for how they were managing supplies, with a vision of how we knew we could help support them and maximize that. So we would have our inventory coordinator side by side with whomever in the clinic was responsible for supply ordering before our presence. And we would calculate how much time in a week are they spending on placing orders, on receiving orders, tracking down back orders, how do they have to manage and keep things organized, taking the cardboard and trash out, right? All the little steps that were anyway tied to having to manage a supply storage room. So how much time was that in a week? We would do that at each location and identify, and it varied, right? Some locations it was maybe 5 hours a week. Some locations it was 50 hours a month, excuse me, 50 hours a month. It just depended on the site. But as we went through and calculated that, that's how we came to our number to say we haven't saved those dollars, right? But we've given those hours back to clinical staff that already existed to be able to focus on clinical operations. But we can only do that through having a system that allows us to manage it well, from our standpoint, more centralized.
Awesome. And what a great thing to give providers and clinicians back time in their day to do, you know, what they love best, hopefully get in front of patients. Okay, so one more question, and Sue, I have to have a comment on this. I love that you said post-pandemic. I mean, can we start saying that more? That's awesome. So Tim, the question is, are you seeing a difference on supply chain interruptions pre versus post-pandemic? I guess that was the first part of the question. And then second, like, how are you able to now like impact the outcome when you know possibly there are disruptions coming?
Yeah, great question, Sue. So first of all, I am the biggest proponent to say we are post-pandemic. I don't know if everybody in my organization agrees with that, but I'm ready to say that. For me, I would say the lessons learned, right? We had these major heartburn experiences in 2020 of trying to manage PPE, as did globally, right? Everyone did. And through the changes that we've been able to effectively put in place, and Omicron was a great experience of this, because we felt from a supply chain perspective, say 4 to 6 months ago, things were mostly back to normal. There's still some issues in the supply chain that exist globally with transportation and raw materials, etc., that there's still back orders that we have to manage. But we felt mostly we were back to normal. Then Omicron hit and everyone started to mass purchase again, right? And for a period of about the last 4 to 6 weeks, we have seen where our inventory did start to dwindle. And we were getting to a point where we were like, okay, we got to stay on top of this. We have to manage this well. But we never ran out of those critical items. And now it's building back up, which is exactly the purpose of why we need to have structured supply chain and planning, because it allows us to have these hits and survive and sustain them. So with that, there's one, how we manage and plan and prepare for a certain period of time of how much stock we should have on hand. And then two is having the systems to look at the data, work with our vendors, and be proactive about what we see is in the pipeline down the line, and not locking ourselves into one distributor and using multiple sources when necessary. So hopefully that helps answer the question for you, Sue. I think it's a great one. I would say we are better post-pandemic than we were pre-pandemic, and hopefully that will continue forever and continue to improve. We're not perfect, we're not there yet, but there's a lot of things that I want to do that will help us better align our, say, scorecarding with our supplier base to keep them accountable as well, because we have our piece, but we rely heavily on these distributors. So there's a piece there as well.
Okay, awesome, Tim. Thank you so much for that. And I think that was a great answer. Those are the only questions we have now, but audience, please keep them coming if we want to go ahead and move on. I think maybe Suresh, are you up next, I think?
Sue is going to start with the presentation, and then Pat and I will jump in.
Awesome. Okay, Sue, thanks so much. It looks like we...
Well, I can start here. Hi, this is everyone. So as Tim so eloquently presented, we all know that supplies are almost 40% of the cost of patient care. And so chief executive officers, chief operating officers are always looking for ways to decrease that cost. It's estimated that by streamlining and standardizing, we could reduce that cost by about 17%. And yet in 2019, we found that the cost actually went up 22%. And so I can only imagine when the numbers come out for 2020 and 2021 that we're going to see that supply costs will have grown even more. So we have to find ways, just like Tim talked about in his presentation, to streamline and standardize and make sure, one, we have the supplies that the providers need and the caregivers need, but that we get them at the best cost we can possibly get them at. Suresh?
Yes, Sue, the next slide, please. Yeah, I think typical healthcare supply chain components, it's any supply chain, data needed for forecasting needs that needs to be accurate and timely collection of the data. And for example, year over year, utilization, and I'm not sure, something was interrupting. Okay, and the ability to develop contingency plans based on various supplier sources. In addition to pandemic, there are seasonal disruptions we need to be able to take into account. The AI-based analytics, the analytics we used to do based on historical data is not enough anymore. We need to be able to employ some artificial intelligence algorithms to compute your needs. And I think the system should be able to provide the employer, your organization, the confidence that system is looking out for the business needs. And all these needs lead to data. Data needs to be available, real time, and where do you have the data in one place? Is it easy to access? So the system using cloud-based infrastructure makes it more accessible, more open architecture, and do analysis in terms of if you are doing analysis on whether medical devices, for example, during COVID situation, medical device shortage, do you know where to get that information? And in cases people are asking for specific location tracking, do you have all the necessary tools to analyze the data? These are the things a standard supply chain health application for a health system should have the ability to do. So can we go to the next one, Pat?
Yes, and so what we found is that during the pandemic, that in fact our contingency plans weren't what they needed to be to meet the needs. There were story after story in the newspaper about organizations washing masks and sharing and putting in emergency procedures to clean ventilators. And so they began to stockpile. They had to determine secondary and tertiary sources. We had states competing against one another to get supplies. So now is the time after this experience, just like Tim talked about at his organization, they took those lessons learned and have redone their contingency plans, but now they have data on how to make those the most effective. And it's important that the healthcare customer understand that organizations have, in fact, stepped up and changed the sources of their supplies so that you're not just dependent on one source. You can look to onshore and nearshore suppliers as well and find partnerships where if the pandemic is bad in one state, but it's not too bad in another state, you could exchange supplies and then reverse that. I think one of the most interesting stories I heard about from the pandemic was Intermountain Healthcare, who literally put in a newspaper ad asking people if they had crutches or walking devices in their homes that they weren't using if they were in the basement or the attic to please bring them in because they were running out of those supplies. So that was a unique way to meet an urgent need. I had not ever heard of that before. Excellent.
So in terms of supply chain, the product itself, I think most hospitals lack the tool set they need to meet those requirements Pat was talking about. I think second is for a specific disruption, whether it's a pandemic related or something else, the ability to determine where and what is available, what is needed. So this is where AI comes in. I think, for example, surgical supply, in a surgery, the supplies constitute over 60% of the cost, as you know, and reducing the overtime, having the right equipment at the right time. These are all part of a supply chain tool set which should provide. So, and this the platform must also be able to incorporate non-incident related peak demands or incident related peak demands as well. And it needs to be at the enterprise level. It cannot be dedicated to a certain segment of your business. And it needs to be able to integrate with other systems. For example, real-time utilization of supplies in patient care. Can you get the data from EMR into the system so that you can project for future? Having the right AI tools, we are able to use predictive analytics based on past behavior. And so there is one customer we worked with. We had to do a prediction based on not only the patient's utilization, also weather systems, location of the clinic. Many of those aspects can be added to the AI model, and then you can create a model which will predict more accurately than standard utilization-based model. And then the ability to communicate the data to leadership and others who need it, and all the reporting you need. For example, if you are tracking implant or other devices which need to be reported to a registry, all those capabilities need to be built into the base platform. So in terms of supply chain support for patient care, I think the Microsoft Cloud for Healthcare data model, which allows you to provide the care, create a personal care scenario, create the patient insight, support this with virtual care, clinical analytics, and care team collaboration, care coordination. All of this Cloud for Healthcare data model based on Microsoft architecture. This system, supply chain system, integrates so well with it, so that the data needed for whether it's for a virtual care or whether it is for a care coordination, for a care team operation, this data is readily available.
So when we talk about the challenges, I mean, Tim actually spoke to many of these during his presentation. You know, having the right supplies at the care where the caregiver needs them, not too many, but enough. Accessing online portals so that you can interact with your suppliers in a much more collaborative process. And as Suresh just talked about, accurate real-time data so that you can know what's going on within your supply chain and react to any emergencies much more quickly. And then the integration of systems, whether it's the electronic medical record with the supply system or the supply system with the suppliers, making all of that as automated as possible streamlines the process, gets the supplies to where they need to be when they need to be there. And it decreases, that it should increase patient care and satisfaction, not decrease. Sorry about that. We'll have to make sure we get that one correct.
It's a good time to switch to the next slide. Yes.
Exactly.
So I think the part of it is that the platform allows you to do this level of automation. You want to go to the next slide, please? Yeah, this platform allows you to implement your processes in a phased approach. So you are not forced to do this all in one swoop. And then I think, like I said, the infrastructure, the technology itself is designed to be patient-centric, even though it is a supply chain and product-based. So it can easily tie into the patient-centered approach for IT. I think Tim covered a lot of that. For example, providing the supply chain personnel to take away the task which patient-centered staff are doing, that allows you to do that. The product should be able to support that. And the projecting purchasing volume and ability to project discounts and help, the tool should be able to help you negotiate with your supplier better. And you can also transform your services. Let's say if you want to focus on ambulatory surgical environment, you can just focus on that. You don't have to do the process improvement across the board. And the supply chain framework this infrastructure comes with is very modern, and it is consistent with the current cloud technologies. And the amount of strain this new system will put on IT is very little, because as a SaaS product, which is cloud-based product, IT's involvement is very limited in terms of the IT's role is going to be primarily focused on connectivity and security. Not necessarily, they don't worry about backing up the data and things like that. API interoperability, because this framework comes with the APIs, application programming interface for non-technical folks. It allows you to integrate with the external system. Anything from complex EDA related integration to simple pop-up. So for example, we have a client where Office Depot is set up as a punch out vendor, where you can go to Office Depot and only buy the predefined catalog items and integrate that into your supply chain without really trying to get out of your system, go buy it and enter that data. You know, And then the multiple the ability to access the application various formats and various locations, whether it is a smartphone, tablet, a laptop, or otherwise. And I mentioned earlier the cloud for healthcare, where this data and application is sitting, complies with high trust requirements, all other security requirements. Microsoft takes the security very seriously, and it is scalable in the sense, if you decide to expand your business, the system automatically scales to meet your needs. And the agility in terms of flexibility and ability to survivability, for example, disaster recovery. The system is automatically backed up to another region in the country, complying with the laws of the state and the federal government. And you don't have to worry about, your IT doesn't have to worry about what happens if this data center goes down, for example. So I'll turn it back over to Pat.
So again, the objectives of any implementation within the healthcare setting is to make sure that we have a higher level of patient care and satisfaction. But when you implement a good supply chain, you also reduce manual processes and the redundancy. You can increase revenues and return on investment, and you can reduce risk of waste because you know what the expiration dates on supplies are going to be. I remember when we used to have Joint Commission groups come in, and we'd always find these expired drugs hidden on cabinets in the nursing units. So with a good supply chain, you know that medication's there and it can be used in the effective amount of time. You maximize your inventory investment. It's scalable, as Tim talked about. And then we've spoken a number of times on the benefits of the cloud environment, but probably one of the biggest benefits is the real-time reporting you get, so you know exactly where you are, what supplies you have on hand, and hopefully that'll help mitigate the impact of future pandemics. Next slide, Sue. One of the questions we had is, so, okay, where can we spend? Just as Tim did some benchmarking of what was being done at the various clinics before the rollout, you can start looking at some of these KPIs in relationship to your supply chain. These actually are from the AHA, the Health Care Resource and Materials Management Group. And if you go out to the website that we've put there, they actually have how you can calculate these rates. So this is one way to think about, okay, where are we today and where do we want to get to in the future? Next slide, please. So I think with that, we'll turn it over.
Yep. Can you hear me?
Yes.
Yes.
Oh, finally, my apologies for my audio issues today. So thank you so much, Tim, Suresh, and Pat. Great information. At the start, I was unable to get on with my audio, but had shared some information just about Quisitive in general, and just wanted to close out the information that we are Catalyst trained. So we can set up workshops with anyone that wants to go through an idea workshop, an envisioning workshop, and look to get started on where there may be an avenue to explore, because ultimately at the end of the day, everything is about patient care. And I think to Tim's point, being able to free up the clinicians, where they have that expertise, but what they want to do is spend the time on patient care, not on these administrative tasks, is really the strength of everything around improving a supply chain. So I just wanted to share this information, and that concludes our part of the webinar, unless there are any questions.
Sue, at the beginning, because of the delay, we started with the Tim. If you want to do an introduction to Quisitive, that would be, this may be a good time.
Yes, let me.
We introduced ourselves, we did not introduce the partner.
I'm going to go back. Yes, sorry about that. So at the start, thank you, Suresh, I will do that. We just wanted to frame Quisitive, where we're coming from, what our experience is. And as you can see on this slide, we have several customers that cross over into different areas of healthcare, hospital systems, healthcare centers, universities, laboratories. We've been able to take the Maze Care built on Microsoft Cloud for healthcare and really roll it out in a very customized way for each customer, whether they're trying to keep people safe on campus, whether they're trying to improve their supply chain, looking at system modernization and how they can get disparate systems to be more integrated and pull together all of those data silos that they might have in their organization. We do have over 18 years of industry experience, and as we've just heard and seen from Pat and Suresh, who themselves have been in that CIO, CTO position at hospital organizations, leveraging that industry expertise with the cloud environment has been just a great avenue for us to be able to build on. And of course, we just did want to, we're very proud of this award, being the Microsoft Partner of the Year for Healthcare this past year. It really goes to the dedication of our team and also of having that platform that Microsoft has built with that security, agility, and scalability. So just wanted to call those out. All of these slides will be in the deck that will be available, but do you want to open it up for questions?
Awesome. Yeah, thank you to Sue, to Tim, to Suresh, to Pat. No, it was a fantastic presentation. We'll be sure, just for all those, in case anyone needs to drop off, we'll be sure to post the recording and additional resources like the deck on the blog post, as we always do. You had mentioned just one question before we end. So you, on the topic of where can people get started, that was, I think, a question that we saw pop up a couple of times. You had mentioned the Catalyst program. I don't know if everybody is aware of what that is, but that's a Microsoft-funded program that enables partners like Quisitive to conduct these ideation workshops, and so that's a potential way that organizations can get started. But curious to hear from the Quisitive team or from Tim if you have any other thoughts on how organizations can get started.
Well, I can share from a
Go ahead.
I can share from a customer perspective, right? I mean, that we went through this process, right? So we had a very antiquated process. We moved into kind of an early version of Dynamics and recognized that we needed to move into a better structure within Dynamics, and that's when we sought out both solicited and unsolicited references, and ultimately, so that now I'm selling Quisitive. So I don't know if that was the intent here, but I mean, we had a great experience hearing positive feedback from other customers who utilized Quisitive as the implementation for the Microsoft Dynamics platform. We were already on a earlier version of it and needed to advance, and it was commented on Maze Care. It's a great platform that they developed that allows us to have really customized, more cloud-based, Amazon-type feeling of purchasing. And I think the key is you have to ask yourself some questions about how robust your system is going to be. And Microsoft and Quisitive helped us kind of come up with those questions to identify what platform should we be on, how robust do we need our system to be, how much is it going to interface with our EHR. Those types of questions, we gained help and support through having dialogue conversations with both Microsoft and Quisitive. So that's from our standpoint how we got started. And then Pat, you can go ahead and add to anything you'd like.
Yeah, I was just going to say that we've all gone through a fairly significant supply chain crisis over the last couple of years. So take the lessons learned from that crisis and, spend some time thinking about what would be better in the future. Do you have the data resources to make the forecast that you would need? Because, I don't know when, but there will be another pandemic or something like it. And we're all going to hopefully be better off than we were when we went into this one. So I would say start with where you are today, think about what worked and what didn't work, and then do contingency plans and make sure that you have the systems in place that will help you have the data that you need. Suresh?
Yeah, thank you, Pat. And I think I will add one more thing from a CTO perspective. I have worked with the multiple supply chain platforms like since the 90s. And as we started automating supply chain, to this platform gives you a lot more flexibility in terms of technical flexibility as well as usability flexibility. There's something we don't like about the system. It's much easier to change than all the older system. We in healthcare are so used to EMR vendors and others holding us hostage with not only with how the system works as well as how where the data is kept. You get out of those shackles with modern system. That's something you want to look for.
Awesome. Well, thanks, Tim, Suresh, Pat, and Sue. We really appreciate the time. We've got another session that's coming up on March 23rd. So it's all about optimizing documentation in the EHR with ambient AI. So it should be just a really great session for anyone in the healthcare provider space, which is just about everybody on this call. As I mentioned previously, we'll post the recording, the deck, and any other resources on the blog post, and we will catch you next time.
Thanks, everyone.
Yeah, thank you, everyone.
Thanks, guys.
Thanks, Tim. Bye. Thanks, Pat. Bye-bye.